Let me get the smaller goniometer. There it is. What's my axis?
Front of your, the top of your foot.
Midway.
Yeah, midline.
Between the right and left.
So, between the medial and lateral malleoli is if you're drawing a line straight through the center of the ankle joint, right? So the most anterior portion of the ankle between the two malleoli. What's my stationary arm aligned with? Tibial crest. Okay. And then my moving arm is aligned with which toe? Second toe. Okay. Now, again, the tendency, because of the shape of the foot and ankle, is for you to push down. Don't do it. I don't recommend it. If you can help it, try not to push it all the way down because it can bias your measurement.
And we won't be able to with our things, will we? I mean, like we're
No,
gonna have these ones.
We'll pass these out. This
Oh.
is the one that's a little bit more common for the smaller joints.
Would it matter if they're in supine or sitting?
I don't think so.
Because I know they show in the videos sitting.
Yeah, I think, truthfully, I think what it comes down to is reproducibility. So you need to do whatever was tested before. Go ahead and sit up. I don't think it matters. It's easier for me to measure at eye level this way. Go ahead and flip your leg over. I don't have a preference. All the way off, come down. It's just easier for me to measure that way, but my thought would be that if someone's sitting, what can they do to cheat here? Go ahead and bring your toes up and in. Further. More. What happens if you want to do more and more? Okay, so you need to cue the person not to move through their hip. Keep their femur stable here on the table. Bring your toes up and in. Okay, good, relax. I'm going to do it now. Okay. How does it feel right in there? Any pain? Stiffness? Okay. I just think this is a little harder to measure personally, but okay. What's normal range of motion going into inversion?
8 degrees. 13.
Let's just say I think it's 35.
Oh,
I think.
must be thinking something else.
Anyone else sound?
It's 35.
Okay, ready? Bring your toes up and in. And relax. That's pretty good. Nice job, that's a lot. 48. Let me see you do it one more time. Good, relax. Okay, now go ahead and bring your foot up, out the other way. Toes up and out, relax. Relax. See a little less there. What's normal in the eversion?
15.
Good answer. Okay, so 35. So we have over double the range of motion actually going into inversion. Hence why we're more likely to roll our ankle this way. Okay, mechanically there's a lot more freedom than there is this way. Okay, go ahead and bring your toes up and in. Same landmarks. Up and out. Sorry, thank you. Up and out. And relax. That's about 17, 18. Not bad. So, based on my general assessment of your ankle, you have a little bit of hypermobility, so maybe some stabilization would be good. What kind of shoes are you wearing? Maybe something with a little bit more support so you don't roll your ankle. And maybe we should do some calf stretches for you. So, Dorsey, 20 degrees is normal. I'd be surprised if anyone had that. 50 degrees of plantar is normal. Most people will have more. Inversion, eversion, 35 in, 15 out. Landmarks are the same for both in each direction there. And try it out. But I really want you to practice. Every time you do it, tell the patient what not to do. It's a good habit to get in because we're all colleagues. We all know physical therapy. We know what not to do, but our patients, sometimes they're what we call motor morons. They don't know how to control their body. So tell them what not to do so they know, okay?
So it wouldn't really matter whether we use supine or sitting.
I don't think it matters.
It would
Again,
depend on the patient again, really.
I would say two things. Do what was done before, because your job is to reproduce and reassess what was already tested. It should be documented. And number two, it's good to be able to adapt it because you need to do what's comfortable for the patient. You may not have a high-low table, in which case it's going to be really hard for you to get down on the ground and measure it way down here accurately. So be flexible, be adaptable, and reproduce what was done before, I think. So, I don't know. I can go either way. I think if someone's sitting up, it's probably more comfortable, more natural. However, my tendency is to think that they can include their hip to cheat a little bit. But If they're in supine, go ahead and lie back down. If it is truly a subtalar, transverse talar movement, what's the drawback? I mean, they still have free range of motion this way, right?
Mhm.
What's the difference? The only, I don't know. I can't think of any reason, but just reproduce what was done before. That's my answer. In the video, don't they show it sitting up?
Yeah, they do.
I've seen it done both ways, but sometimes it's easier. You're in a hurry. The patient's already in supine. You've measured plantar dorsal. Boom, get the inversion, eversion done. Beth, where'd you go? Oh, you have a preference for the exam? We want to make sure that we're consistent.
Whatever works, but for me personally, and I think body mechanics wise, bending over someone's foot is poor body mechanics if you were measuring from this position and leaning over someone as opposed to having them sitting and being able to look
That's
at
fair.
the foot.
I want you to be consistent. I want it to be consistent.
So you're saying it's better to do sitting or better to
It's better
do?
to do sitting, because
Okay.
if they're lying down, I'm gonna have to lean over them. And I've treated some people with some pretty big feet that are poking into me, so this
Fair enough. That
is
makes
not
sense.
as good body mechanics to be. But again, either way, as long as the gastroc is slacked and the patient's in an okay position, you may have a patient who can't sit up comfortably.
Sure,
So
master's
it's good to have
qualification.
options.
Is there an echo?
Okay, any questions? Practice?
I saw in that, the joint range of motion book,
Yeah.
where they were doing some measurements in prone. Is that something different?
Yeah.
It's something completely different. I put up on the videos, you are not gonna be skill checked on these.
That's for
Measuring the calcaneus shaft.
Hindfoot measurement stuff? Yeah, we're not gonna do that here. Okay, practice, please. Please